Well, some 4,300 South Africans require organ or tissue donation. Yet only 1.4 donors per million people are registered organ donors. This is much lower than in Spain, the world leader in organ donations. So what can be done to encourage more people to become organ donors? To tell us more, Sandra Fenter from Vita Nova Tissue Bank joins us. Sandra, a very good afternoon to you. Let's start by maybe understanding the difference between the tissue and, the organ donation. Just for our viewers, just to understand the differences.
Yes. So organ donation, Otemba, is generally that person who decides to donate organs and tissue after his death to help somebody else through transplantation. But the typical organ donor is somebody who lands in hospital in ICU with a severe brain injury and is on the heart-lung machine. In that case, where the person is declared brain dead, organs can be donated. And with organs, of course, we mean the heart, lungs, kidneys, pancreas, and so on. However, only about 5% of all people land up in those kind of circumstances and then can donate organs. The rest of us die elsewhere in the other circumstances. And then we can still donate tissue. And with tissue, we mean corneas, bone and tendons, skin, and heart valves. And for that type of donation to happen, there does not need to be the circulation of blood. In other words, the patient or the donor can already be at the funeral home or at forensic services, and we can procure tissue anything between 12 hours after death and even up to 5 days after death in the case of bone tissue.
You know, Sandra, we're talking about a decline clearly in the uptake for organ and tissue donation. And it is quite a complex, very emotional and sensitive subject, because you're talking to people who have religious, cultural, or belong to organizations, and societies and groups and family members who are really, not very keen on this. So let's do a comparison. If you're saying there's a decline in the uptake, what has been the situation and the status so far?
Unfortunately, there is a huge shortage. And if we have to compare it with other countries, like you said, Spain, for example, the uptake is much bigger. And I think in our South African society, there are additional factors. You know, we have our cultural and religious beliefs. We have a little bit of mistrust in the biomedical system for some of us. Some of us are too much influenced by negative media, unfortunately. And even when there are reports of unethical research that might take place elsewhere in the world, we so easily adopt that belief and thinking, and we make that fear our own. So there's a lot of fear and mistrust around the concept. But I think what's very important for us to understand is that the South African legal system really safeguards the person who wants to donate. The Health Act describes very well who can donate, what the processes concerned are. And so it's an environment that's well controlled. And we really hope that there can be more discussion.
Who can donate, Sandra? Who are the people who can donate?
Really, not about tissue donation, anybody, I want to say, from children and really from 16 years up to the age of about 80 years old, people who are of reasonably good health, and many of us have all sorts of normal ailments like diabetes and cardiac disease, high blood pressure, that sort of thing. It really doesn't matter. We can still donate tissue. And at the time of death, it's important to know that the medical team will assess to see if a person is suitable. The trick comes in, however, you and I can decide to be a donor, to register with the Organ Donor Foundation, to put it in our last will and testament. But at the time of death, that is actually the next of kin who makes the decision, who needs to give permission for organs or tissue to be recovered. And so therefore we say discussion, the topic needs to be discussed at home so that family members know how people feel about the topic that they would like to donate. Because when we cannot speak for ourselves, it's important that our families know how we feel.
Could the decline be because of COVID-19? And while we're on just that note, as we wrap up, you know, how has COVID-19 or those who have died from COVID-19 affected the uptake? And would organs and tissue from those people be used as organ donation?
So unfortunately, it has severely impacted on the whole sector. Of course, with the demand for hospital beds, there hasn't been that many transplants. People haven't been able to identify potential donors because of that. But mostly, we are unable to use people's organ and tissue at this stage who passed away because of COVID. So also the number of people, younger people who succumb to unnatural circumstances due to things like car accidents and violence and so on, those numbers have declined. And although that is a very good thing, it has had an impact on the availability of potential donors.
In 5 seconds, what can you say to people who have doubts, who are not sure, or who have just never thought of it, or just think this is deplorable?
Really, you need to educate yourself. Go to the website of the Organ Donor Foundation. There's a stack of information. Engage with the topic, speak to each other. Death comes for all of us, sooner or later. Let's be prepared for it. Let's know what we want and discuss that with your family so that they will be able to carry out your wishes when the time comes.